Jonah, we are ready. Okay, Jess, this is your patient assessment, medical assessment, psychiatric / behavioral. You have 15 minutes time limit to complete this skill sheet. You are dispatched to a police assist. No other information is given to you by dispatch at this time.
All right. BSI, is my scene safe?
Your scene is safe. You have multiple officers there on scene.
All right. Is this my only patient?
Yep, cop comes over and says that this is you only have one patient.
All right. I'm going to consider requesting for additional EMS if needed. At this time, I don't see a need for it. I'm going to then consider C-spine for the patient.
Okay. So the cop comes over and says that the guy was out acting crazy. It took him like 15 minutes to wrestle him to the ground. He got really agitated and combative when they got there. When they got him on the ground, they had to tase him to put him in handcuffs, and it took like 6 officers to wrestle him to the ground.
Okay. So my general impression of this patient is poor. He's having some sort of behavioral health episode. So I'm going to go ahead and determine that this is a patient that we should probably get to the hospital quickly. And I'm going to then assess my patient for responsiveness. Is he talking to me?
Yeah, he is just screaming absurdities, yelling at everybody. He's not really making sense. He's seeing things.
Okay. All right. So I'm going to then determine if there's any life threats, any obvious bleeding, anything that I need to be concerned about right now.
No notable life threats.
Okay. I'm going to then go into my ABCs. I take that back. I'm going to say my general impression of this patient. General impression would be this patient is having some sort of psychiatric or behavioral health issue, and we need to get him to the hospital.
Okay.
And then I'm going to go into my ABCs. Airway, is his airway patent and open?
It is. He's just open mouth screaming at you.
Okay. All right. Breathing. How is his breathing? Is it equal bilateral?
Yeah, you notice that it's rapid.
Okay.
Rapid, but it is bilateral.
Okay. So at this time, I'll consider that this patient might need some oxygen and some. Is there any chance that this patient has a breathing injury? Anything like? Do I notice any any flail rib segments, anything like
No,
that?
unremarkable. You don't notice any trouble with his chest with ventilation.
Okay.
His ventilations are good.
All right. I'm then going to look at the patient's circulation, pulse, skin color, temperature, condition.
Okay. Pulse is rapid.
Okay.
Rapid and regular. You don't notice any major bleeding. Skin color is beet red all over.
Okay.
Temperature is hot.
Okay.
He's hot to the touch, and he's not diaphoretic.
He's not diaphoretic. Okay. So at this time, I'm going to make my transport decision. I think we need to get this patient to the hospital quickly.
Okay.
And then I'm going to move into getting history. I'm going to get sample history and OPQRST.
Okay, so the cop, the guy's unable to answer any of your questions. He's using inappropriate words. Cop says that they've been out there for maybe 15 minutes trying to wrestle the guy to the ground, and he'd been out there for at least 10 minutes before they arrived, throwing stuff at cars and yelling. But he's unable to answer anything else for your OPQRST. For your sample, the cops know that he is a pretty heavy drug user. They know that he's usually IV, and this is odd behavior for him.
Mhm.
They've had multiple run-ins with him. They've been to his house. They have never seen any medication bottles. They don't know if he's on has any allergies, and other than the IV drug use, he has no other past medical history.
Okay, I'm gonna have my partner get vitals. I'm gonna have another partner get an IV, and I'm going to what are his vitals?
Okay. Pulse is 130.
130. Okay.
BP 190 over 120.
Okay.
Respiratory rate is 34. Is there anything else you'd like to know?
Blood sugar.
Blood sugar is 88.
Okay. I'm going to then. So I'm gonna get a EKG. Have my partner get an EKG
Okay.
at this time.
Notice sinus tach.
Okay, sinus tach. All right. And I'm gonna gonna go ahead and sedate this patient. I'm gonna give 5 milligrams of Versed, and then I'm going to reassess vitals.
Okay, you're gonna get 5 milligrams of Versed.
Mm-hmm.
What's your route, sir?
I'm gonna give IV.
Okay, IV. So you sedated him. He is Solomon right now. Vitals are starting to come down. His pulse is now 100. Respiratory rate is 22. Blood pressure is 140 over 90. Temperature has not changed.
Okay. All right. Then I'm gonna go ahead and get into a secondary assessment. I'm gonna go ahead and have my partners do a full body secondary assessment, starting from the head going down.
All right. You don't notice any decap ETLS on anywhere on the patient.
Okay.
Before you sedated him, you didn't notice that he was slurring his words or anything. He seemed pretty strong.
Mm-hmm.
Nothing wrong with the neurological part.
Mm-hmm.
And other than that, he was just altered mental status and combative.
Okay. All right. So then I'm gonna reassess and reassess all the interventions that we've done, vitals, and then we're going to transport the patient to the hospital as quickly as possible. Reassessing the airway, reassessing blood pressure, and at this time I'm done with this patient.
Cool.